The United States has one of the highest costs of healthcare in the world. From health insurance premiums to prescription drugs and hospital bills, the expenses can pile up fast. So today, let's dive into how we can improve accessibility and affordability to quality care.
So if you break down the payment model, just in general, you have the insurance, you have government-sponsored insurance, and then you have the cash pay, right? And so the insurance model is maybe provided by an employer or you're paying out of pocket for this, access to this insurance. And then you have kind of the government insurance, which is the Medicare and Medicaid, which are supposed to guarantee you access to physicians. However, a lot of people either don't qualify, or if they do qualify, they can't find a doctor that will take that insurance. And then lastly, you have the cash pay option. Right now, there is a trend where you're seeing a lot of physicians go towards that route. Because if you have transparency with pricing with your doctor and exactly what you need, you know what you're gonna pay and exactly what you're gonna get. Oftentimes, whether you have insurance or cash pay, you're going to your primary care doctor because you trust them, you have a relationship with them. Primary care to me is basically a physician that treats a wide scope of issues. Any age, young to middle age to old, and really focuses on preventative care, but also has the knowledge to treat acute management of chronic illnesses, patients that are complex, patients that are simple. So that's kind of, they say it's the gateway into the healthcare system, where it all kind of starts with a good primary care doctor. So with all that being said, direct primary care basically cuts out the insurance. The benefits of that is it gives the patient the reins back as far as how they want to direct their own care. It also provides the doctor with more autonomy, meaning that they can make decisions in conjunction with the patient and not have to worry about any sort of outside influence. When patients are looking for a primary care provider, I think the biggest thing is honesty, transparency. Really the biggest key I see is the availability. So knowing that if you need to be seen within 24 hours, you can get seen. MedBerry Clinic was created in order to offer primary care to the community. The MedBerry Network model is our direct primary care model. You have access to primary care, preventative services, urgent care, blood work, but specifically with the network, we get unlimited office visits, unlimited urgent care visits, unlimited mental health counseling and treatment, and then we also have a weight loss program. To compare traditional insurance versus direct primary care or the MedBerry Network, typically people often think of it as one or the other, but we do have a few patients that have insurance and then also use the MedBerry Network. And the benefit of that is when you have the network, you're paying a flat fee once a month to get access to the clinic and all the services that we provide. However, if you get hospitalized, then that's where your insurance would kick in and cover this big hospital bill, for instance. Anybody would benefit from having a primary care doctor or for being part of the MedBerry Network plan, whether it's just for preventative services, getting the annual visits, the blood work, the testing. Patients that benefit the most from it, I think, are patients that are anywhere from the age of 30 to 45. Maybe they've developed a few health issues or problems. The goal is, of course, to have them have a better quality life in the end.